Hello everyone. In this video, we will be studying about important bodies in the pathology. We will be discussing their images and important points. So the first image shown here is of tennis racket shaped granules. Tennis racket shaped granules on electron microscopy are seen in Langerhans cell histiocytosis. And in the Langerhans cell histiocytosis, what is the protein that is found in this granules? That is Langerhans protein. Then the next image we have is of asbestos bodies, also known as bamboo bodies or ferruginous bodies. And they are thin, curved, drumstick appearance, and they stain positively with pearls Prussian blue stain. That is, they are iron containing bodies, so they will be staining with the pearls Prussian blue stain. And these are found in asbestosis and silicosis. So, in the asbestosis, these bamboo shaped bodies or ferruginous bodies will be given, the brownish colored bodies staining with pearls iron stain. Next image is of Homer right rosette. Homer right rosette. These are central nerve fibrils and peripheral small tumor cells. Okay, in the center we have the nerve fibrils and at the periphery we have the small tumor cells, and it is found in neuroblastoma. And also these cells, the small cells, also found in Ewing sarcoma. The CD number for Ewing sarcoma is CD99. Basically, the small cell tumors, that is Ewing sarcoma, neuroblastoma, nephroblastoma, retinoblastoma, medulloblastoma, all these tumors have small cells and they can have rosette, Homer right rosettes. Then next image is of Schiller dual body. In the Homer right rosette, it was nerve fibrils in between, but this is perivascular structure. The blood vessel is in the center, consisting of tumor cells arranged around a blood vessel. So the tumor cells here, the tumor cells are arranged around a blood vessel. This is called Schiller dual body, and this is found in endodermal sinus tumor, also known as yolk sac tumor. In the yolk sac or endodermal sinus tumor, we have the Schiller dual body. Then we have the Kohl-Exner bodies. Kohl-Exner body are found in granulosa cell tumors of the ovary. In the granulosa cell tumors, there will be small eosinophilic fluid-filled spaces in between the granulosa cells. Means these are granulosa cells, and in between the granulosa cells we have the eosinophilic, that is pinkish colored fluid filled spaces. The fluid filled spaces are in granulosa cells. In the Schiller dual body we had the blood vessel. In the Homer right rosettes we have the nerve fibrils in between. Then the next image is of sporotrichosis cigar bodies. Cigar or asteroid bodies, these are known as porotrichosis, is a type of fungal infection. So basically, the eosinophilic, it is composed of the central fungus. In the center, we will have fungus, and with the eosinophilic material is radiating from the fungus. So this is known as cigar or asteroid bodies, and the phenomena is known as splendor happily phenomena. Splendor happily phenomenon. Then this is another image, asteroid body. Asteroid body is also found in sarcoidosis. Okay, in the sarcoidosis also we have the and other granulomatous diseases, we have the asteroid bodies. Then next image is of Cowdry type A and type B bodies. Cowdry type A is large eosinophilic with a clear halo. Type A will be large and eosinophilic and with a clear halo. And type A bodies are found in herpes and varicella, herpes simplex, that is HSV1, type 1 herpes virus, and varicella zoster, that is also a type of herpes virus only. So basically in herpes virus we will have Cowdry type A bodies, and in the other virus Cowdry type B, in the polio virus and in the adenovirus the Cowdry type B. Type B, remember by the mnemonic B BAP, BAP. B bodies are found in adeno and polio. Cowdry type B are basophilic. They are bluish colored. B for basophilic, B for bluish color, filling up the nucleus with margination of chromatin, more than ground glass appearance. Then the next image we have is of copper penny bodies. Copper penny, also known as medlar bodies or sclerotic cells. And these are seen in the chromoblastomycosis. Chromoblastomycosis, it is a fungal infection and it is caused by Phonecia fungus. Okay. And it is a type of chromophilic fungus, that is a fungus giving the color. Medlar body, sclerotic body, copper penny body, chromoblastomycosis. Then the next image we have is of Donovan bodies. The Donovan bodies have classical safety pin appearance and these are found in granuloma inguinale, that is also known as pseudobubo. It is a type of STD. Granuloma inguinale or pseudobubo. If you want to see the gross image, you can visit the dermatology images section. The granuloma inguinale pseudobubo, it is caused by Klebsiella clematobacterium, also known as clematobacterium, and it gives the safety pin appearance. Then next we have the semoma bodies. In the semoma bodies, basically there will be ring-shaped calcification or hyaline material will be deposited, and this is due to the semoma bodies, and it is found in meningioma, papillary carcinoma of thyroid, malignant mesothelioma, and serous cystadenoma. Papillary carcinoma, thyroid, meningioma, mesothelioma, and serous cystadenoma of the ovaries, semoma bodies. Then next we have Antony type A and type B bodies. Antony type A and type B bodies are found in schwannoma. Schwannoma, that is the tumor of the vestibular nerve. That is the tumor of the vestibular nerve, acoustic neuroma. It is spindle-shaped Schwann cells arranged in interlacing fascicles, and Antony type A is densely cellular. The area where the nuclei present very densely, that is known as Antony type A, and the hypocellular loosely arranged cells are known as Antony type B bodies. And the verrucae bodies, nuclear palisading around the fibrillary processes, also known as verrucae bodies. So all the three terms, Antony type A, Antony type B, and verrucae bodies, is related to schwannoma. Then next we have the stomatocytosis. Stomatocytes. Basically, stomatocyte is mouth or cup-like deformity. In the hereditary spherocytosis, it is found in hereditary spherocytosis and immunohemolytic anemias. Then we have the ore rods. The ore rods are shown by the arrows. These are dense azurophilic granules and these are basically found in myeloblast in the AML M3 promyelocytic variety. Then the next image is of Mott cells. Mott cells are found in multiple myeloma. Mott cell is a plasma cell characterized by accumulation of multiple Russell bodies, globular cytoplasmic inclusions composed of immunoglobulin. Basically, the Mott cell is in the multiple myeloma. The immunoglobulin inclusions are there in the cytoplasm. The globular inclusions are there. That is known as Mott cells. Then the next image we have is of flame cells. Flame cells are also in the multiple myeloma. Imagine multiple myeloma setting the marrow on the flame, on the fire. Immunoglobulin inclusions. These are producing so much immunoglobulins that they are setting the immune system on the fire. So flame cells are produced. Then this is elder-Reilly bodies. Elder-Reilly bodies are deeply basophilic granules within the neutrophils. The very deep basophilic granules, very much bluish color in the neutrophils, that is in the Hurler's and Hunter syndrome. Hurler and Hunter syndrome basically is a type of mucopolysaccharidosis. Then this is image of Cabot ring. Cabot ring is a nuclear remnant and It is seen in the Cabot ring in the RBC. It is a type of nuclear remnant. It will be appearing in the shape of loop or eight shape, and it is seen in post-splenectomy, in the hemolytic anemia, and in the megaloblastic anemia. Post-splenectomy, hemolysis will be occurring, and megaloblastic anemia. And it is caused by fragments of nuclear material. Cabot ring is a nuclear material. Like nucleus is in the form of ring, Cabot ring is also a ring, so Cabot ring is a nuclear material. Then we have Dowley bodies. Dowley bodies are endoplasmic reticulum. After the D comes the E. So Dowley bodies are endoplasmic reticulum, patches of dilated ER that appears as sky blue. It is with sky blue colored cytoplasmic puddles, and it is seen in sepsis, myelodysplastic syndrome, and Chidak-Hagashi syndrome. Means in the infectious conditions and in the dysplastic syndromes, myelodysplasias, and Chidak-Hagashi syndrome. Not in anemia we found Dowley bodies, we found it in several other conditions. While the Cabot ring was present in anemias and hemolytic anemias and postplanectomy. Then we have the banana bodies. Banana bodies are crescentic shaped bodies within the Schwann cells, means in the shape of banana crescent. We have the bodies, and it is seen in disseminated lipogranulosis. Lipogranulosis or ochronosis. Ochronosis is linked with joint conditions. Then is Rao-Perkin bodies. Rao-Perkin bodies are seen in androgenic alopecia, and it begins a small cluster of elastic fibers in the neck of dermal papilla. They clump in the catagen, and with progressive shortening of the anagen, multiple elastic clumps. Basically, these are elastic clumps in the hair follicle in the dermal papilla in the androgenic alopecia. Rao-Perkin bodies. Then we have Schaumann body. Schaumann body is a shell-like lamellated basophilic calcified protein complexes in the giant cells. In the giant cells, in the sarcoidosis, we have the granulomas, and the granuloma, the giant cells are found in the giant cell. If we have shell-like calcification, lamellated calcification, that is known as Schaumann body. Shell-like Schaumann body. Then next we have bodies of Ferentius. Bodies of Ferentius are small nodules located at the cusps of aortic and pulmonary walls. Basically, the nodules on the aortic and the pulmonary walls that are bodies of Ferentius. Then we have Ashkoff body. Ashkoff body is seen in rheumatic heart disease. This whole thing is known as Ashkoff body, and in between this, the cells found are Anishko cells, and Anishko cell is basically a macrophage, and it is seen in rheumatic fever. The other condition in which it is seen is iron deficiency anemia, recurrent hepatic stomatitis, and chemotherapy. Chemotherapy, deficiency anemia, and recurrent hepatic stomatitis. Then next we have Davidson body. Davidson body is basically nuclear chromatin bud in the female neutrophils. In the female neutrophils, like female have two X chromosomes. The one X chromosome goes inactive, and that is formed as Davidson body in the female neutrophils. Then we have Crayola bodies. Crayola bodies are clump of benign respiratory epithelium in the sputum indicative of asthma. If the benign respiratory epithelium is found in the sputum, then it is known as Crayola bodies, and it is seen in asthma. Then this we have the Bullinger bodies. Bullinger bodies are intracytoplasmic eosinophilic inclusions in the epithelial cells of birds. Bullinger bodies are basically found in fowl pox. In the epithelial cells, we will have eosinophilic material. Then we have caterpillar bodies. Caterpillar bodies are elongated epidermal eosinophilic bodies. In the epidermis, we will have eosinophilic, that is pinkish colored bodies, and these are formed in Porphyria cutaneata tarda. Porphyria cutaneata tarda. Porphyria is linked with the pigments, and in the caterpillar also the pigments produce the colors. When it goes old, like in a butterfly, different colors are found. So Porphyria cutánea tarda has caterpillar bodies. Then we have Buninia bodies. Buninia bodies are found in motor neurons of the anterior horn cells in ALS. In the ALS, in the CNS condition called ALS, we have the myotrophic lateral sclerosis. We have Buninia bodies. Myotrophic A for a myotrophic lateral sclerosis, and after myotrophic, we have B, A after B. A is followed by B, so we have Buninia bodies. Then we have councilman bodies. Councilman bodies are basically acidophilic bodies. In the upper right of the image, we can see acidophilic bodies. These have cytoplasmic inclusions, and these are found in the viral hepatitis and in the yellow fever. While the ballooning degeneration, the ballooning of the cells, is shown in the center. Then we have zebra bodies. Zebra bodies, that is types of the white and black, are found in lysosomal storage disorders, mucopolysaccharidosis, that is hunters and hurlers, and these are cranial nerve nuclei found in cranial nerve nuclei, liver and skin. PAS positive, LFP positive, and water soluble. And these are rare in metachromatic leukodystrophy. Then we have colloid or kivart bodies. Colloid or kivart bodies are spherical eosinophilic hyaline material seen in or below the epidermis in lichen planus. So below the epidermis we will have spherical eosinophilic material, that is colloid bodies, the colloid in the lichen planus. Then we have body of Highmore. It is a mass of fibrous tissue continuous with the tunica albuginea that projects into the testes and is also known as mediastinal test. Bodies of Highmore. Then next we have Lewy body. Lewy body is a round eosinophilic structures found in the cytoplasm of neurons. Eosinophilic structure, Lewy body, and it is seen in Parkinsonism or Alzheimer. The next we have chromatoid bodies. Chromatoid bodies are elongated cigar-shaped bars with the blunt round ends. They occur in Entamoeba histolytica. Chromatoid bodies are found in Entamoeba histolytica. In the cytoplasm, we will have cigar-shaped bars. Then is splenic Gamna Gandhi bodies or Gandhi Gamna bodies. These are seen in due to the passive congestion of the spleen. The blood flow in the spleen, venous flow is hampered, so it is found that the congestion happens, and it is seen in CML, sickle cell anemia, also seen in chronic myeloid leukemia and sickle cell anemia and cirrhosis liver. In the things which the blood flow, venous drainage of the spleen can be hampered, and the Gamna Gandhi bodies are found. So that were all the bodies, important bodies in the pathology section. Frequently the questions are asked. So I hope this will be useful to you. If you like my content, please do share and subscribe my channel. Thank you.